Hello everyone, this is Alex from Swoosh English. Great to see so many of you in here today. We just had a couple of technical issues, but we are ready to go. I'm excited to be teaching you all about OET reading part B today, how to be successful in this section. Very, very soon, I'm going to be joined by our UK OET teacher, Alexander. So you're going to have two UK OET teachers helping you today, answering all of your questions, helping you with the exercises that we're going to give you, giving you feedback as well. So we want to help as many of you as possible today. If you're in our Zoom class, then please let us know who you are. Let us know if you're a doctor or a nurse, and let us know which country you are living in right now. So please let us know in the chat box. And if you're watching on Facebook Live, then please again introduce yourself. If you want to come into our Zoom class and be live with us here inside the class where it's a lot more interactive, you can ask more questions, you can get your answers answered by us a lot faster, then make sure you go to swooshenglish.com/free class. So that's swooshenglish.com/free class, and you can come inside with us and we will be able to help you with a lot more support that we can provide to you. So that's it, swooshenglish.com/free class, and you can come inside the class. So great to see so many people here today. Let's see who we've got. Okay, we've got Sarah, who's a nurse, Dr. Milton from Bangladesh. Sarah's from Saudi Arabia. Dr. Reem from Saudi Arabia. Dr. Asma from Egypt. Sumya, Nassim, Sijo, Maz, Fernanda, I remember you. How are you? And lots of people say, Carmen, good to see you, Carmen. Ashifa. Okay, I think Carmen, you joined our program recently, so great to see you in our paid program where we can give you a lot more support. Sumya is a nurse from Kuwait. Taufik, Valentinos from Cyprus. Fantastic. So people from everywhere. Dr. Nassim's from the UK, Sijo from the UK, Greta's from India, Augusto Sampaio, I remember you, Augusto, Dr. Augusto from Portugal. So people from absolutely everywhere. Great to see. And Wendy's living in Saudi Arabia, Bridget from Zambia. Okay, great. Okay, so let's see who we've got on Facebook. Okay, let's see who we've got on Facebook. We have got, let's see. Okay, Swoosh English. And so let us know what the difficulties you're having with reading part B right now. What are the difficulties that you're having? Because remember, part B and part C are a lot different from part A, and we'll be covering that today. So let's see what people are saying on Facebook. Let's see who we have. Please be as interactive as possible in the session today. The more you participate, the more you get involved, the more you get out of the class. Like I said, it's better to be inside the class, inside the Zoom class with myself and all the other students, and then you'll be able to get your questions answered a lot faster by us. Also, make sure you share today's Facebook Live video. So even if you're on Zoom or you're on Facebook, just get your phone out and just share the video to your Facebook page, step 1. Step 2, if you write underneath the video, I have shared the OET live video. So just write underneath, I have shared the OET live video. We'll give you our free mini mock exam for reading and for listening. So you'll get that completely free. This was a mini mock exam that our UK OET teachers put together for you in order to get the practice that you need for your examination, okay? So, and that is on part B of the reading, and we've also got a listening exercise for you as well. So Samira, and we've got Lana, we've got Fatima, Juliet, Eva. Okay, so I'll put the link in there for you. So we're going to be joined by Alexander in a minute or so. So I've just put the link inside Facebook Live, swooshenglish.com/free class if you want to come inside the Zoom session with us. We've got Dr. Fatima, We've got Eva Maria, Juliet. Sukaina's one of our doctors in our paid program. Good to see you, Sukaina. Nasreen. Okay, fantastic. I've shared the OET live class video, said Eva. Great. You will get our free mini mock exam. Okay, Eva Maria, if you've registered, you'll get an email confirmation. And then once you get that email confirmation, then you can click the link and then you'll come inside the class. So you need to check your email, Eva. Okay, I've shared the video. Fantastic, said Rahim. And Greta, great stuff. Okay, so now I am, let's see where else. We've got more people coming in. Sukaina's here inside the Zoom class. Seema is one of our doctors. Good to see you, Seema. Doctor from Bangladesh, Tawfiq. Okay. Okay, awesome. So let's see if I can bring Alexander into the class. And let us know if you've been taught by Alexander before and was the class helpful to you. So please let us know if it was helpful to you. We get a lot of good feedback about the classes that Alexander does. So please let us know. Okay. So let's see if I can see Alex here. Okay, I'll make you co-host, Alex. Okay. Hi, Alex, are you there?
Yeah, I'm here. Can you hear me?
I can. Yeah.
Great.
Hopefully you've got the permission to, there you go. Okay.
There we go. Cool.
Great stuff, Alex. So, Alexander, can you let us know, for anyone who doesn't know you, for anyone, if it's actually, and let us know in the chat box, is this your first time to be taught by Alexander and myself today? Please let us know if this is your first time. But if it's not, and you're a doctor or nurse who's been to the class before, please give us your feedback in the chat box. But like I said, yeah, for anyone, it's their first class today. Alexander, if you can just briefly tell students about your experience and how you can help them to pass the OET exam.
Sure. So I've been working in English language teaching for about 7 years, and in different environments. I've worked with people from different cultures, Asia, South America, and obviously in Europe and the UK as well, which is where I'm currently based. And I've been working mainly with the OET for about the last year or so, working on materials development and looking very much at the different parts of the test, how they're put together, and what some of the key strategies are in terms of how to perform well in the different aspects of the exam. So that's the sort of information that I want to share today in order to help people improve their performances.
That's great, Alexander. Like you said, we're going to give you the strategies, the tools, the tips, the techniques that you need today to be successful with reading Part B. We've got lots of people who said, Annalyn said, it's my first time coming to the class. Islam said it's so beneficial, so I'm guessing you've been before, Islam. Seema said it's my second class and it was very effective, the last one. Sijo, Margaret, my first time. Lots of people. Okay, so there's quite a lot of people saying first time. Well, you are in for a treat today when we go ahead with the class. So I'm going to hand over to Alexander now.
Okay, well, hello to all of those who are part of the class. For those who've been here before, it's great to see you again, and I hope that you are interactive and you get involved in the class as much as possible. The more interactive that you are, the more that you're going to be able to learn from the experience, and the more that you're going to remember as well. You always remember the things that you do when you actively participate more than you remember the things that you just hear. So I hope you get involved, and for those who are getting involved for the first time as well, feel free, please, as well, to get involved, to answer questions, to participate as much as possible. I'm going to be asking you a lot of questions as well as providing a lot of information. So the two of those things together are what are designed to help you progress. So hello, Seema, I can see you there, and Sukaina, hi. Thank you. Great to see you in the class as well. So as Alex said, we're going to be focusing today on OET Part B. And just as a starter, let's have a look at what that involves, this section of the exam, the reading section Part B. So first of all then, a quick pop quiz. Give your answers in the chat. How many questions are there in reading section Part B? Oh, very quick responses here. Sijo, Bashkar, Sukaina, Nasim. Jasmine, yeah, fantastic. Everybody's saying, almost everybody giving the correct answer, 6. Yeah, there's 6 questions in reading part B. Okay. Reading part B is it gapful or is it multiple choice? Okay. MCQ says Bashkar, Jasmine, Joseph, Anu. Fantastic. Okay, just one person saying gap fill. No, it's multiple choice. Absolutely. And Bashkar's even given more information. It's 3 options. So 3 option multiple choice questions, A, B, and C. 6 questions. How many different texts will you have to read for part B? Okay, Sukaina, Sidra, Iman, Valentinos, Anu, Floridel. Okay, brilliant. Everyone saying 6. Okay, then. So this is the situation then with reading section part B, is that for each question, there is a specific text. So when we're reading that text, we're only doing it in order to get access to 1 mark, essentially. Now, the texts are quite short. From the responses that I'm seeing here, most of you are quite familiar with the breakdown of it. There's 100 to 150 words per text. And the idea is that you need to be reading this information, obviously pretty quickly, and answering a specific multiple choice question. Okay, a question now that might be a little bit more tricky. Thinking about the time that you have available to complete parts B and C together. Well, first of all, let's ask that question. How much time? How much time do you get to complete sections B and C? The 2 sections combined. Okay. Whew. Fantastic. Most people giving the correct answer. Yeah, 45 minutes. So thinking about that then, how much time do you think you should spend on each of the questions in part B? If you're going to apportion your time equally between all of the questions, how much time would you spend on it? Okay. So we've got 2 minutes. That's Fernanda, Nasim, Sukaina, Bridget, Svetlana saying 1.5 minutes, Seema 45 seconds, Islam 1 minute. Okay, so most people are saying about 2 minutes. That logically makes sense because you've got 6 questions for part B, and then you've got in part C, you've got 16 questions. So in total, you've got 22 questions, 45 minutes, which means on average, you've got about 2 minutes per question. So ideally, if you were going to apportion an equal amount of time to each of the questions that you have in parts B and C, and each question is worth 1 mark, you would give 2 minutes per question. So this is the goal then for reading part B. Within 2 minutes, we need to be reading the text, we need to be going through the options, and we need to be making the right decision in terms of which is correct, A, B, and C. So there's not a lot of time, more time than you should definitely be spending on questions in part A. Part A is particularly about expeditious reading, reading at speed. But part B is a little bit challenging in terms of time as well. We don't have a lot of it, and so we need to use strategies in order to be able to get to the correct answer as quickly as possible. So let's start looking then at some of the tips then, some of the things that I would recommend in terms of approaching part B. So in part B, there's 100 to 150 words, but the information in those texts is very dense. So it can be quite difficult to break down those texts in order to get the exact information that we need. What are some of the ways that we can approach this though? So let me share some ideas with you. The first thing that I would recommend in terms of approaching this is to think about your own experiences. So we've discussed the fact that there are 6 texts in part B. What sorts of text would you expect to be facing? What sorts of things do you think are going to come up in part B? So would you expect to read newspaper articles, for example? Would you expect to read magazine articles? Okay, larger health-related topics, absolutely. But what kinds of things? Would you expect to sort of read research articles? Okay, so kind of memos, yeah, possibly memos. Bashkar's saying journal articles, not for part B. That's more part C, you would expect to see things like journal articles. Bridget is saying emails, absolutely, an email could come up. So policy updates, great, absolutely. So it's this sort of text that we should expect to be exposed to. It's basically the sorts of things that you would see in your workplace. So you think about, all of you are healthcare professionals, and so you all are involved in working in a healthcare context on a daily basis, or most of you I'm sure are. So you're going to be exposed to these sorts of things. You have to sort of read emails related to the jobs in which you work. You're going to see workplace memos. You're going to be exposed to guidelines, instruction manuals, which is all part of working in a healthcare context. So is it fair to say that you've all been exposed to this sort of information working in your healthcare context? What would you say? If it is fair to say that, then just say yes in the chat. Okay, so Naseem, Hafida, Bashko, absolutely. Okay, so you're all saying yes. Great. So in that case then, you've been exposed to this sort of material. It may not be in English, but you've been exposed to this sort of material. You have an idea as to the sort of information you would expect to be in this material. You have an idea as to how the material might be structured, whether it would be kind of bullet points, or whether it would be sort of guidelines, sort of sequences, like first of all, then do this. Okay, so the first tip that I want us to look at then is background knowledge. Make use of your background knowledge. All of the texts are going to be from a medical healthcare perspective. They're all based on things that you would find within a workplace, within a healthcare workplace. So when you begin to look at these texts, they shouldn't be too unfamiliar to you. They should be things which are familiar, things which you can access, things which you should be able to make sense of using your own background experience. And it's important that you do this. So, for example, even though you might be reading about things like a blood transfusion process, or you might be reading about nasogastric feeding tubes. These are the sorts of things which probably, depending obviously on the sort of healthcare context in which you work, they're probably not going to be completely unfamiliar. So do use your own background knowledge, do use your own background experience in order to help you make sense of the texts. Okay, so as soon as you go in, you're expecting, okay, I'm going to read a manual here, I'm going to read an email here, it's in a healthcare context, okay, I've had experience here, so you can come into it and approach it with a certain level of confidence in terms of the content. Challenge, obviously, is going to be the language. So let's move on now then and have a look at some aspects of the language and also some aspects of the strategy. So for these questions, they're all based on multiple choice. Do you think it's necessary to read all of the options A, B, and C, before you make a decision as to which is correct? Okay, Svetlana, Sukaina, Jasmine, Hafida, everybody is saying yes. Yeah, absolutely. You do need to read all of the options. It's not just a case of having to read all of the options. You have to read all of the options very carefully. So once you've orientated yourself to the main topic of the text, okay, you've worked out, okay, it's a manual, it's a memo, it's an email, great. So you've got the main idea. Now you can start to move on to look at the details within the options. So let's have a look at an example here. It's a crucial step to read all the options carefully, because a lot of students, in my experience, have made mistakes because they haven't read the options carefully enough. We can look at an example here. Here we go. So we've got an example question. The manual informs us that the blood pressure monitor, and then we've got two options. Obviously, there'll be three options in the real test, but just for the practice here, we've got two options. So should be considered safe to use in all hospital environments. It's likely to interfere with the operation of every piece of medical equipment. But why do you think, if you notice here, I've highlighted two words. I've put them in italics, all and every. Why do you think I've done that? Why do you think that these words can be particularly important in the context of multiple choice options for Part B? Why all and every? What could be significant about these words? Okay, so Seema's saying they're keywords. Yeah, they can be, but why? Why could they be keywords? Okay, this could be sort of general. Yeah, I mean, all and every is basically, it's saying something quite specific here, isn't it? Let's have a look at the first one. Absolute, good, yeah. Yeah, Jello's saying that. All and every often points to a mistake. Yeah, it could. So if we have a look at A, for example, so the manual informs us that the blood pressure monitor should be considered safe to use in all hospital environments. Let's imagine we're reading the text, and the text says something like, the blood pressure monitor is safe to use in the majority of hospital environments. So suddenly what we've seen here is that we've got safe to use, we've got hospital environments, but it's saying the majority. Is the majority a synonym for all? If it says the majority, does that mean the same thing as if it says all? Okay, good, yeah. So Nassim, Sijo, yeah, it doesn't mean the same thing. So it's very easy for the OET to put together certain options which look as if they're correct, but just because of these words, these sort of absolute terms like all and every, it means that even if we find information in the actual text which makes us think, oh yeah, okay, there's a lot of words here that are quite similar, I'm going to choose this option, that one word can actually change the meaning quite significantly. There's a big difference between saying that the majority of something is safe to use and saying that all of something is safe to use. So these are the sort of some of the things that the sort of the words that can come up which can actually change the meaning and can lead us to making mistakes. That's how we end up getting distracted by not paying attention to really specific words and phrases within the text. Okay, so we'll come back to this in a moment, but that's something that I really want you to think about. Really make sure you read the options carefully so that when you go through the text, you're making the correct decision. So the next tip then, I've got here, work out whether you're reading for gist or detail. What is the difference, quickly, between a gist question and a detailed question? For those of you who've been on this class before, you should have an idea of this. What's the difference? Okay, I'm just having a look at Hafid is coming here. Might find in the text not all or not every. Therefore, we need to focus on it. Yeah, exactly. Yeah. So you need to focus on the details in the question so that when you read the text, you know exactly what the text is supporting. If it's supporting the majority, but it's not supporting all, then that's a clear indication, really, that that option is not correct. It's being contradicted. So yeah, the details are important. Okay, so let's have a look. So gist is the main idea. Absolutely, main purpose. Yeah, that is absolutely right. The gist is, what is the main purpose? What is the main focus? And some of the questions in the OET will be asking that question. What is the main purpose, or what is the main focus of a memo, of an email, etc.? So what about if we're reading for detail then? What do we need if we're reading for detail? What will we have to find within the actual texts in order to support a detail approach? Okay, so Jasmine is saying synonyms. Yeah, absolutely. It could be the fact that there are synonyms between the options and the actual text. Specific information. Yeah, okay, so specific information, but specific information which is going to be quite difficult to find. It's not just going to be sort of a word or a phrase. We need to be, yeah, detecting paraphrasing, detecting synonyms. This is something we'll come up to in the next tip. But absolutely, this is a crucial part of reading for detail, is being able to find something specific within the text, to go inside of the text in order to get the information that we need. So, if we have a look then, I've got a question on the screen here. The manual informs us that the blood pressure monitor, and now we've got all three options for this question. Just looking at the question, what kind of reading skill do you think you're going to have to use for this specific question? Do you think it's going to be just reading, or do you think it's going to be detailed reading? Just have a look at the question, and then in the chat, let me know what you think. Okay, so we've got a few responses here. Detailed reading, we've got from Jasmine, Floridale, detail, Seymour, detail. Okay, so everyone is saying detail. Can't see the question. Okay, so it's on the screen here that I've got this PowerPoint. You hopefully should be able to see the question there. Okay, so yeah, this is going to be detailed, isn't it? The manual informs us that the blood pressure monitor. Okay, and then the three options, if we read them, is likely to interfere with the operation of every piece of medical equipment, may not work correctly in close proximity to some other devices, should be considered safe to use in all hospital environments. So what we can see here then is that in order to answer the question, we're going to have to go into the text to find some specific details in order to help us. And let's just have a quick look. We can find the information, or we can find the answer to this question by finding contradicting information within the text. So there might be some information that contradicts it. So I just discussed before, finding the majority instead of all would be a contradiction. And also it's possible to find something specific within the text which could give us the answer. So we'd have to use synonyms, we'd have to use paraphrasing, we'd have to really focus carefully, but it is possible to find a specific detail within that text which can give us the answer. So we should be expecting to go through that text. We're going to have to read it in detail. It's not just a case of quickly scanning, because that information could be anywhere within that densely packed 100 to 150 words. But it's not going to be a gist question. It's not just the main idea. We're looking for a particular detail. Once we find the detail that we think has given us the answer, we can underline that, just quickly cross-check it with the option, and then we can make that selection. So that would be a detail question. But let's have a look at another question. Okay, so have a look at this one now. Is this still a detail question, or is this a gist question? Okay, so Seiko saying gist, Bridget gist, Bashkar gist. Yeah, okay, so process of elimination really. The first one was detail, the second is gist. So in that case then, if in order to find the answer to a detailed question, we're going to have to go into the text, underline something specific that helps us to get the answer. With a gist question, how is that a little bit different? Okay, just to check, sorry, can everybody see the screen at the moment? I've got someone saying that I'm not showing my screen.
Alex, I can see the screen perfectly on my side.
Okay.
If anyone can't see, it probably means that you might be using a mobile phone, and we always recommend you to watch on a laptop or PC. So we're trying to do the best we can, but yeah, you'll have to look on a laptop or PC if you want to use it, to be able to look at it really clear. Sakina said, I can see it really clearly. Carmen said, I can see it. Okay, great.
Okay, good. Okay, so yeah, so we just going to the point I was making before then. So for a detailed question, we're going into the text, underlining a specific part of the text that gives us the answer. For a gist question then, how is that a little bit different? Is it easy enough in the sense that we can just underline a specific part of the text to help us? What do we think? So Siho's saying that they're pointing out something. Okay, but imagine you're in the test now, you're reading the question, you're reading the text. How can you read that text in order to help get to the answer? Okay. We need to read carefully. Yeah, you do need to read carefully, but also you're trying to get here, remember, the main idea. So you need to ask yourself a specific question. You need to ask yourself, really, why was the text written? Okay, what was the purpose of the text? Why was it written? And also you need to be asking yourself the question as you're reading the text, which part of this information is providing background and which part is providing the main focus? Okay, and so that's a decision that you've got to make as a reader. What is the main focus of this text? It might be the case, for example, that you have a gist question where all three of the options, they seem to be mentioned, but only one of them is going to be focusing on the main purpose of the text. And so you need to be having a look at it, making a decision. Okay, this looks like this is providing background information. This looks like it was the main reason why the text was written. It's like if you get an email at work, for example, the email might say, hello, for example, Jasmine, I hope you had a good weekend. I just wanted to let you know that I've had a call from a patient and she wants you to blah, blah, blah. Okay, so in that email, there's information, there's a greeting, there's this wishing you well for your weekend, but that email has a specific focus, a main focus, and that main focus is obviously to let you know about what a patient has said, what a patient wants you to do. And you would naturally detect that as a reader because you would be able to pick out what information was background information and what information was providing the main focus. So that's the question that you need to ask yourself. Why was this text written? And then the answer to that question is going to be either option A, B, or C. Okay, so we're going to do a little bit of practice with this, as I say, a little bit later in the session, but this is something that I want you to bear in mind. Are you reading for detail or are you reading for gist? Okay, so we've discussed it a little bit already, But paraphrasing, what is meant by the term paraphrasing? Someone give a definition. Okay, so someone has put synonym, same meaning, yeah, same meaning, but, and here we go, yeah, Jasmine, in other words. Absolutely. So paraphrasing obviously applies very much to the OET reading exam and the OET listening exam, come to think of it. And it's something that we should be prepared to face as we are approaching this exam. And for both detail and just questions, a large amount of paraphrasing is likely to apply when working out which of the options is correct. So if, for example, we have a look at the blood pressure monitor question again, and let's imagine that the answer was, say, question B. It says it may not work correctly in proximity to some other devices. In the actual text, we might find something a little bit different. So this is a point now where I'm going to share the text. So I've made it a little bit easier for you. I've told you that the answer is B, but what I want you to do now is to tell me, why is the answer B? What have you found specifically in the text which gives you that answer? So let me just bring up now that question, and I'll share it with you just now. Okay. So, so here we are then. So we've actually got the text now. We've got the three options at the top, and I've made it easier for you. I've told you that the answer is B, but I want you now to share with me the exact words from the text that give you that answer. Okay. So I'm just going to give you 30 seconds or so to read through, and then in the chat, if you can share the exact words that give us the answer B, then we can have a look at this together. Okay, and try to give the full part of the sentence. So we've got at the moment, yeah, we've got some sort of specific words which are coming out. Care should be given. The last sentence, electromagnetic interference within 7 meters. Okay, okay. So yeah, what gives us the answer here then is it's the final sentence, isn't it? So we can highlight pretty much really the entire sentence. Okay, so this point, yeah. So nevertheless, care should be taken to avoid the use of the monitor within 7 meters of cell phones or other devices generating strong electrical or electromagnetic fields. So just to break this down a little bit then in terms of how it works in relation to paraphrasing, the option B says close proximity. Close proximity has been paraphrased with the reference to 7 meters. So 7 meters is obviously, it's pretty close, isn't it? You know, it's so close proximity, 7 meters is how that has been paraphrased. And another way in which it's paraphrased, it says some other devices. So, you know, may not work correctly in close proximity to some other devices. And this is a little bit more specified here because it says within 7 meters of cell phones or other devices. So it gives us the specific device, the cell phones, and then the other devices as well. So that's how that's paraphrased. And then the final part of it, where it says care should be, where it says may not work properly, well, may not work properly is paraphrased by saying care should be taken. Why is it necessary to take care unless it's going to affect the working of the machinery? So the words are different, but the idea is the same. And that's the point. We've got to get used to recognizing that, how the same idea can be communicated using different words. And that's the sort of approach that we want to take to a detailed question, because, you know, we need to read through very carefully, find the specific part of the text, and in this case we can underline it. But it's a detailed question because we have to recognize the paraphrasing. We have to recognize how different words are being used in order to communicate the same idea. So so that's how we would do it in relation to this kind of question, a detailed type question. Okay, so let's do a little bit more practice now. Then I've got a few exercises that we can look at together. So let me just bring those up. I'll just share that now. Okay. Okay, so a little bit of practice. So we've got another question this time. Okay, a new question. Let's make it big, so hopefully everyone can see it. Okay. So can everybody see my screen at the moment? If you just let me know in the chat if it's clear for you. Yes, good, good. Okay, fantastic. It seems to be clear. That's great. So first question then. So have a look at the actual extract. What kind of extract is it? Is it an email, do you think? Or is this a sort of thing that you would find in an instruction manual? What kind of extract would you imagine this kind of text to appear in? What do you think? Take a moment to read it very quickly, quick skim, and then tell me what you think. Okay. So any ideas then? So do you think that this is the sort of thing that you might find in an email exchange, for example? Okay, so Elijah's saying a memo, notice, possibly. Possibly. Okay. So we've got someone who's answering the question already. Yeah, article. I think, yeah, some kind of article, isn't it? It's likely to appear. So if you have a look at it, it's got a little introduction. Cleanliness has been described as a human right and not a luxury. Yeah, so some kind of article that you would find, some kind of sort of medical article, which is providing information in relation to, in this case, bed baths. Okay, so just before you answer the question, we will come to that. The next thing that I want you to think about is, have you read anything similar to this in your own hospital environment? Have you ever sort of, looked at a sort of similar article, whether it be in English or whether it be in your own language? Is this a sort of article that you might be familiar with in some way from your own healthcare professional experience? Okay, so Margaret is saying yes. Augusto, yes. Jasmine, yeah. Okay, great. So if you have read something similar to this before, then that's where you can start to use your own background knowledge, isn't it? Straight away, you can look at it and say, okay, sort of bed baths, it's the sort of thing I'm familiar with. It's the sort of thing that I've been exposed to in my own professional experience. So I've got that background knowledge. I've got that background experience. Brilliant. Okay, so you should feel more confident and comfortable when approaching the question. Now, okay, so again, some of you are giving answers. We will come to the answers. I'm not going to confirm what is correct just yet, but because I want us to use the strategies that we've been talking about throughout the class thus far. So what I want you to think about now then, I want you to read the question carefully. Okay, read the options carefully, options A, B, and C. Remember, that was part of the strategy. Which words are used in the options in this case instead of all and every? Which words are used which can replace all and every? So just have a quick look at A, B, and C. So remember, with all and every, we were talking about absolute language, weren't we? And if you've got something which provides lots of absolute language, then we can find contradictions in the text sometimes. Okay, brilliant. So Nassim is saying sometimes, yeah. So if you look at A, it says why bed baths are sometimes necessary. So if it was absolute, it would say why bed baths are always necessary, in which case we'd have some absolute language and maybe we could find a contradiction to it. But in this case, we don't have that because it says sometimes. Good. And Alfie is noticed as well, sometimes. Any other examples of how absolute language is not used in perhaps B or C? Okay, so great. So Bhaskar has picked up on C with often, Alfie with often. Yeah, so again, they're often left to lower level nursing staff, not always left to lower level nursing staff. Okay, so yeah, and great, yeah, and also Florida del Cima picking up on B, it can, how bed baths can maintain patient dignity. So in this case, all of the options have been, they're not absolute options, are they? So this shows us, okay, we can't just rely on something being absolute in this case, all of them are sort of giving a little bit of leeway. So we need to be very careful when we look at the text to see exactly which of these options is being supported. So this is just a way to practice really reading the questions quite carefully. Okay, so let's have a look at another approach. So now I want you to tell me what kind of reading skill are you going to use to approach this question? Is this a gist question or is it a detailed question? What do you think? Are you going to be able to find a specific part of the text, to underline a specific part of the text, which will give you the details to answer the question? Or are you looking more at the overall purpose of the text in order to get the answer? What do we think here? Okay, so we're a bit divided on this, aren't we? Is the question you're asking yourself, why was this extract written? Or are you asking yourself more, what is a detail that I can find in this text which will allow me to choose options A, B, or C? Okay, so we're almost 50-50 on this. It can be a tricky one. It is a little bit of a tricky one, but I think when we'll see this when we approach the answer to the question, I guess the real way to determine this is how can we answer this? Do we answer this by looking at the overall purpose, asking the question why, or do we do this by underlining something specific in the text which can help us? Okay, final question then before we confirm which answer is correct, and I'll go back to whether it's a gist or a detailed question as well in just a moment. Are any of the options paraphrased in the text, options A, B, and C? Can you find any examples of paraphrasing of options A, B, and C in the text? If you can, please share that in the chat. So any paraphrasing that you can find. I'll just give you about 30 seconds on that to share some ideas. So, okay, so Sigor is saying A, but can you give a specific example of how it's paraphrased? So Bashkar is saying in order to prevent. So what is that paraphrasing then, Bashkar, do you think? There are circumstances for A. Okay, so why bed baths are sometimes necessary. Okay, very nice. Nassim saying the same thing. There are circumstances sometimes. Okay. Necessary equals not a luxury. Okay, absolutely. Good. First sentence, yet they are often left. Why bed rests are often left to nursing staff. Interesting. Yeah. I mean, definitely, this is the point, isn't it? C is definitely mentioned, isn't it? Because if you look at it, the extract explains why bed baths are often left to lower level nursing staff. And then it says here, such activities are a vital aspect of providing nursing care, yet they are often left to junior or newly qualified staff. So you've got that paraphrasing, lower level being junior, newly qualified. Yeah. Okay. So there's a few options that are paraphrased here in the text. Okay, so some of you have given the answer already, but now we've looked at some different strategies. We've looked at paraphrasing. We've looked at, we've activated our background knowledge. We've really read the options carefully. So tell me what you think now. Do you think that the answer to this is A, B, or C? Tell me what you think. So I'll just give a few moments so we can get as many responses as possible, and then we can have a look and see which one is the correct answer. Okay, so a lot of A's and B's so far. Not many people putting C. We've eliminated C, apparently. Another one for A. Okay, so we're 50-50 split on A and B here, by the looks of it, more or less. Okay. Nassim, why not B? Okay, Okay, so let's have a look at this. So we'll look at the answer, and then we'll go back to the GIST detail question as well, because I think the two things are linked. So first of all, we've got to look at the question really closely. We've got to look at the question. So the first one, A, is asking why. The second, B, is a question which is about how, and then the third one is also why. So none of you put C, which is good, because C was not the correct answer, because even though it mentions the fact that activities are a vital aspect of providing nursing care, it doesn't tell us why bed baths are often left to lower level nursing staff. In fact, in a way, what the extract is telling us is that it shouldn't be left just the lower level nursing staff, because it's so important. So we don't get the answer why. So because we don't get the answer why, even though certain parts of option C are paraphrased, we can eliminate that option. And now we're left with A and B. Let's have a look at B. So how bed baths can maintain patient dignity. So from this extract, do we learn how bed baths can maintain patient dignity? I mean, before you answer that question as well, think about it from your own personal background, your own personal experience. How would bed baths help to maintain patient dignity? How do they do it? How does it make the patient, what sort of questions would you want to answer in order to provide an answer to that? You know, how does a patient feel having a bed bath? That's a question, isn't it? How does the patient feel once they've gone through that particular experience? So you're looking at the patient's emotions. You're looking at the patient's reactions to having a bed bath. Is that contained within the extract? Do we know how dignity is maintained? Because remember, dignity is a very personal thing. It's a very personal thing for the patient, so we'd expect to have some information about how the patient is feeling, what the emotional responses of the patient to having this sort of procedure. So, yeah, Maya's saying, no, we don't really get that sort of information. We don't, okay? However, when it comes to the question why bed baths are sometimes necessary, well, do we get the answer to that question? If I said to you, why are bed baths sometimes necessary? Can you give me the answer to that by looking at the extract? What is the answer to that question? Yes, okay. Why? Why are bed baths sometimes necessary? Using words from the extract. Can you tell me? So give me the words then. Give me the exact words which answer question A. Okay, good, yeah. They're necessary to maintain personal hygiene. Exactly. Personal hygiene needs to be maintained, so bed baths are necessary in order to maintain that. So that is the answer to the question. Why are bed baths sometimes necessary? Well, because there are certain circumstances in which patients will not be in a position to maintain their own personal hygiene. In such cases, they may be reliant on nursing staff. Okay? So this is giving us the answer to the question. It's telling us that the answer is A. And so that tells us then, of course, if we can find the answer by underlining a specific part of the text, that of course tells us that what we've just faced is a detail question. Okay, we found the answer within the text, we got the details, and so there it was. So for those of you who chose A, there you go. And you even have the paraphrasing of sometimes, because you know why bed baths are sometimes necessary. That's paraphrased here by saying that they may be reliant on nursing staff to perform hygiene-related activities such as bed baths. Okay. So for those of you who put B, that's the question that you've got to ask yourself. You know, which specific part of the text is telling us how patient dignity is maintained? Okay. That's the question that you've got to ask yourself. And we can't really find a specific part of the text which talks about patient dignity in that way. Maintains their hygiene, absolutely. But hygiene and dignity aren't exact synonyms here. Dignity is more about the patient's feeling and emotions, whereas hygiene, of course, is very much a physical thing. It's a very important thing physically that hygiene is maintained, because if you have poor hygiene, that can lead to greater exposure to other illnesses and diseases. So that's the point, yeah. In this case, we don't have a synonym between hygiene and dignity. So this is a detail question, and that's the sort of detail that we want to go into in order to answer this type of question. So just very quickly then, since we've had a look at GIST, I just want to quickly share with you a gist question as well. So remember, we said for a gist question, you're not necessarily going to be able to underline a specific part of the text. This is something where you're asking yourself the question, why? Why was this text written? What is the main focus of the text? So let's just quickly bring up a different text here, and then I want you to give an answer to that question. Why was this text written? Just quickly share that with you now. Okay, so first of all then, how do you know that this is a gist question, except for the fact that I've just told you? But what is the clue here to tell you that what you're going to be reading now is a gist question where you're looking at a main idea? Okay, great, yeah. So Violetta, Nassim, Bashkar, Fernanda, yeah, Tausif, all saying it's purpose. It says the purpose of this email is to, okay, absolutely. So if it's asking us what the purpose is, it's asking us basically, what is the gist? What is the main idea of this particular email? It's telling us it's an email. Why was this email written? Okay, so I'm just going to give you a minute now to have a look at the options and have a look at the text. Or let's say 2 minutes, because you'll get 2 minutes in the exam. 2 minutes, have a look at the options, have a look at the text, and think about this. Why was this email written? What's the main purpose of this email? A, B, or C? So remember, for this, it's not necessarily going to be one specific word or phrase, but it's going to be the text as a whole is going to tell you what the purpose is. Which part of it is background, which part of it is the main focus. Remember, this is the question. You're asking why. Why was this email written? Okay, just give another 30 seconds and then we'll have a look at the answer together. Okay. Okay, so looking at the answers then, the vast majority of answers are B. I can see that. Bridget, Violetta, Fernanda, Alfie, B, BB. Yeah, almost everybody's saying B. I think I saw 1A, 1C. The vast majority of people are saying B. Okay, so let's have a look at this then. So the purpose of the email is to report on a rise in post-surgical complications, explain the background to a change in patient care, remind staff about procedures for administering drugs. Well, almost everyone is saying B, and I think with good reason, haven't we? So first of all, though, let's have a look at some of the other options. So report on a rise in post-surgical complications. Is that the main reason why this email was written? So there is it says this reported the incidence of respiratory depression. So it's referring to another text, isn't it? So in August, an alert was issued. This reported this. Okay, so there's a reference to it, but if it was the main focus was to report a rise in post-surgical complications, we'd expect more of the text to be dedicated to that particular topic, wouldn't we? You know, if we have a look at retrospective multi-center study, cardiopulmonary arrest cases show that 40% were respiratory related, more than 35% occurred on the general care floor. So this is talking about sort of different statistics and sort of, what has occurred within a healthcare context, but it doesn't necessarily say that there has been a rise. It does give a lot of statistics, but we don't see, that there's sort of a general trend which is saying, okay, it started here, it's gone up to an increased point. So I don't think that's going to be the main purpose of the email. Remind staff about procedures for administering drugs. Again, I mean, you know, this is mentioned in a way, but it doesn't really go through the main focus of what the procedure is, you know, because if that was the main focus of the text, we'd expect, okay, so we need to do this, we need to do this, first of all, then after that. So we'd expect that the text to be organized in that particular way. If we look at B, though, which is talking about explaining the background, we have some really useful language which is telling us that we're looking at the background of something. So right from the beginning, in August, talking about the past, talking about the background to a situation. It tells us that. And then it goes on to describe the situation. Failure to recognize respiratory depression, and you know, it tells us a bit of information there. And then it talks about a retrospective multi-center study. So retrospective, looking back into the past, looking into a background situation, and just trying to highlight that there, retrospective. And a lot of the information that we get is basically telling us about the history to the situation, i.e. the background to the situation. Therefore is a key word. So Siji is talking about the final sentence. All of this information is therefore, you know, it's therefore recommended that post-operative patients now have continuous monitoring. So basically, you know, 80% of this text is giving background and is being used to justify something. It's therefore recommended that post-operative patients now have continuous monitoring instead of spot checks of both oxygenation and ventilation. So basically, it starts off by giving us all of the background, and only the final sentence is telling us what the change is going to be. So the main part of the text is focused on telling us why that change is going to happen, and the reason why is based on that background. So that is the key. You know, why is this text written? What is the purpose of this text? It's giving us loads of background and saying, look, this is the reason why. Therefore, you know, we need to make this change. So well done to those of you that put B as the answer. Obviously, you were able to successfully detect what the main focus was and the main purpose for this text being written. And that is one of the main things to focus on, really, as far as strategies for Part B are concerned. Dealing with the detail, you know, finding a specific part of the text which gives you the answer, recognizing the paraphrasing, and looking at the options really carefully, because if it's a detailed question, then the detail of the words used in the question are going to be really important in terms of finding the answer. And if it's a gist question, then we've got to be really good at sort of asking the question, okay, why? Why was this written? And being able to recognize the overall purpose of how the text is put together. So, yeah, I guess this is a good moment now if anyone has any specific questions to have a look at that. So yeah, so Fida's saying detailed questions are quite hard. Yeah, I mean, that's the thing. You've got to recognize the paraphrasing. The paraphrasing is what makes it sort of difficult to penetrate. And you know, obviously you don't have a lot of time to do it, but if you read the options carefully, then once you go into the text, it's a question of underlining the part of the text which relates back to the options. And you'll see distractors, you'll see parts of the text which refer to the options maybe 50%, but not the whole way. You know, it will say the majority, it won't say all. And so it's recognizing the differences really between what is giving us a full answer and what really is only giving us a partial answer. We don't want to go with partial answers, we want to go with what's giving us a full answer. So Milton is saying answer C. If you're talking about the previous question, Milton, the answer was B for that in terms of what the purpose was. It was to give a background to the explanation, to the change. Okay. Part B is part of the mystery, indeed. Indeed it is. All and must is the same. It depends on the context, of course. It depends on the context in terms of how the word is appearing. But I mean, they're both absolute, definitely. All is absolute, must is a very strong term as well. Okay, thank you. So thank you for all those who attended. Thank you very much.
Great stuff, Alex. Thank you very much for that. Alex, can you just can you just make me co-host? For some reason, it won't let me.
How do I do that?
Be co-host again, just next to my name.
Yeah.
Under panelist, and then if you can just click, I think should be a blue button that comes up when you hover over my name.
So I hover over your name. What? Just
on panelist on the right hand side of your screen.
Ah, right.
Yeah.
So just,
okay, everyone. So if you can just put everyone in the chat box, what's the biggest thing that you've learned today so far? Okay, because Alexander and I will be sticking around for questions. So please let us know in the chat box. If you're in Zoom, let us know what your biggest takeaway is that you've learned today. And then on Facebook, if you can also let us know as well. Many thanks to both of you awesome teachers. You're very welcome, Sakina and Alexander. Alexander, we appreciate your guidance at SEMA. Thank you very much. Very helpful. Okay, so Margaret has learned, be very careful when selecting my choice of answers. Okay, so yeah, Alex, it says a panelist, but if you can, next to my name, it should be able to say, we'll come up with a blue button saying maybe more or something. I think you're looking in the wrong place. It's top right. Should be top right. Yeah, top right. If you, or under the where it says participants at the bottom,
yeah,
click participants, and then when you click panelists, click participants, then panelists, and should be able to see Alex on the top right afterwards.
Because I've got more here, and then I've got all panelists and attendees. That's what it says there, and then I've got.
So my name should be under panelist, and then you can make me co-host next to my name.
Okay, so, but that.
Okay. No, it's not working.
No, it's not coming up with anything.
Because you're the host on your side.
It just says it basically says panelists. It's faded grey, and then but it doesn't give me the option of making you the host.
I don't know why that's not happening. Okay. Okay. Because it's all. I don't. It should come up on the top right-hand side.
I've got it at the bottom where it just says.
Top participants should come up on the right hand side.
No, it's not saying anything about participants.
No, participants at the bottom. Click that where it says 36.
So I've got all I've got is where it says at the bottom. So all panelists and then more, but it's not. It doesn't give me anything in terms of.
That's okay. No worries. Okay, thank you everyone. So please can you let us keep telling us what you've learned today, and Alex and I will be sticking around for questions. So if you've got any questions for us, then please let us know. Bridget said quite a beneficial session. Thanks a lot. We've got Islam learned outlining the paraphrasing in the text. Okay, that's great. Let's see if I can share my screen. Apologies that you can't, everyone can't see me. There's a couple of technical issues on our side. Sure, yeah, you can see me now. Okay, good. And Jasmine learned, oh, Jasmine, good to see you. If the words in the text and the words in the options are the same, doesn't mean it's the way to trick us. Thanks a lot to everyone, said Milton. You're very, very welcome. Please let us know if this session has been helpful to you. So what have you learned so far? Please let us know. Hafida said, I learned to focus on how and why, which gives an idea about my emotional side. Be careful about details. Nassim said, very, very helpful. Awesome. Okay. So we know that a lot of students have got their exam coming up soon. Can you let us know in the chat box if you've got your exam next Saturday? Okay, next Saturday, the 23rd of February, or you've got your exam on the 16th of March. Please let us know, when is your examination, everyone? When is your exam? Okay, is it next week, or is it in March, or is it in April, or you've not booked your exam at all? Sakina, 16th of March. Svetlana, 16th of March. Next week said Joe. April said Margaret. 23rd of February said Alfie. Nassim, 16th. Jasmine, next week. Not booked yet. I think, Milton, that's what you mean. Okay, good. So for people who've got their exam next week and people who've got their exam in March, if we were able to give you 6 full mock exams for reading and listening, would that help you? Okay, would that help you to be able to have 6 full mock exams for reading and listening on our learning platform? Okay, where you would have access to all of the materials. You'd have access to questions and answers. You would get all of the answers that you got correct, so you get a score immediately. You'd be able to get our analysis videos after you've taken each exam. One of our teachers who's put the exam together, Alexander, we've got Damien, and we've got Tom, our 3 UK OET teachers who put these together. They would be able to analyze where you went wrong and what you can do to improve, and then we will give you a recommendation as to what we think your level is and how you can improve. If you would like access to that, I'm just going to quickly show you. We've got that available for you right now, and we're going to be, we've got it until the end of today, okay? So if you can see here at the top, when you go to swooshenglish.com, because we get so many students asking for more mock exams, and we've got 6 mock exams for you, and they're available until you pass. So we want to be with you every step of the way to help you pass your examination. And when you come to swooshenglish.com, you will see this here. You can see a limited time offer, 4 video courses. So you get all of our video courses for reading, writing, listening, speaking, plus our 6 mock exams for just $99. So you get all of those things for just $99. So you've got all of the video courses for reading, writing, listening, speaking, and then you've got 6 full mock exams with your scores and the analysis videos as well. If you want access to that, all you need to do is click get the offer there, okay, and then you'll go through to this page and you can read. If you're a doctor, we've got mock exams for doctors and mock exams for nurses. So we've got reading, writing, listening, speaking mock exams depending on whether you're a doctor or a nurse. It's only $99, but it's only available until the end of today. So if you want access to full mock exams, 6 in total, then I'd love to see if we can help you with giving you access to all of that. So thank you very much for coming today, everyone. Really appreciate you taking time out of your day to come along to our session. If you've got any questions for me about when you should book your exam, any questions at all about taking the OET and your difficulties, why you're having trouble with reading, writing, listening, speaking, why did you fail your past exam, anything like that, I'm more than happy to help you. So all you need to do is come into the session now. Okay, so it's swooshenglish.com/free class, and I will give you access to as much help and support that I can provide you as possible. So if you're in the Zoom class already, stay around and I will answer your questions. If you're on Facebook, then make sure you come inside. So thanks very much if you're on Facebook, and thank you to everyone who has come in on Zoom today. And I look forward to helping you with your examination moving forward. And like I said, we do have our $99 mock exam promotion right now that we will give you access to. Oh, I'm still sharing my screen. Okay, good. So thank you very much. It seems that God bless you. I appreciate it, said Sakina. Okay, we've got a few other comments from people. Appreciate it. Okay, thank you very much. When are you doing listening? Well, if you get access to our 6 full mock exams, Margaret, you can have all 6 mock exams available whenever you want, okay, until your examination, okay? So thank you very much to everyone who's on Facebook. I appreciate you coming along if you're on Zoom as well, and I look forward to helping you with your OET exam. So for everyone who's in Zoom, I will stay around and answer your questions. For anyone who's on Facebook, thank you very much. Keep sharing the video. If you share this video to your Facebook page, and then underneath the sorry, I should say, when you share the video to your Facebook page, step 1, then step 2, if you write underneath the video, I have shared the OET live class video, you'll get access to our free mini mock exam, okay? It's a very short mini mock exam, which is for reading and for listening, and that is available to you completely free of charge. We've created that for you. So thank you very much, everyone who's on Facebook, and I'll stay around for questions in Zoom.